Here to talk about barriers to access for eligible families for Head Start and early Head Start. And specifically, we're going to focus on a national field survey that we did that yielded a huge array of results. And that's what we're going to be covering today. I particularly also want to dig into things and barriers that are rooted in bias or prejudice and discrimination, looking at issues by race, ethnicity, income, geography, disability, or ability was a big part of our survey. And so want to dig into that piece today. I do want to start by just offering some recognition and thanks first for our funder for this work, Voices for Healthy Kids. They're a really wonderful funder who's focused on health equity for young children and families. And so they were a very generous funder and really helped us and supported us to do this work. And if you'll bear with me one moment, I'm going to take a quick pause and I'll be right back with you. Apologies for the delay. We'll get back to our show here. I also want to recognize and thank a number of the Head Start community who did a lot of work to get us here today. Those folks are listed here, and I particularly want to thank a couple NHSA staff members who added significant input and expertise to the project, Amir Moore and Victoria Jones with NHSA. So I want to recognize and lift up their expertise today. So to get us into the framing, right, of today, access is about a lot more than eligibility. And that's what we wanted to dig into with this survey and this body of work, right? So think of some of the other dimensions of access and go ahead and feel free to add them in the chat, ones that come to your mind too here. But right, outreach and enrollment, right? That's free from prejudice or bias or discrimination is one that comes to mind, right? Receiving high quality and accountable services. We're really big on accountability in Head Start, and that for a good reason, right? Receiving linguistically and culturally appropriate services, receiving services that meet family needs. So again, access is about a lot more than the eligibility and being able to join the program. It's about a lot more than that. So we also want to look at and overlay this issue of discrimination and prejudice and bias, right? And so when you think in this context, right, and of course, discrimination impacts a lot of parts of our society, almost every part of our society. But when we're thinking about this part of our society in our context, some of the barriers that might be discriminatory that come to mind, right, those that might be explicitly exclusionary. So you think of the income eligibility, right, for Head Start. And how that is explicitly excludes certain populations. Now, there may be good reasons for that, but there may be non-good reasons for that. And that income eligibility is something our field is talking a lot about, as we'll see in this survey. Barriers or things that are punitive, like DRS, something that's purposely bureaucratic, right? We know government can be purposely bureaucratic. Think of burdensome paperwork for families or providers. When you build on other inequities, think of the digital divide, think of communicating with our families. When you build on other inequities, that can create discrimination. And unequal to need, this is a big one, right? In our country, especially where we have a lot of need, whether it's around child poverty, education, healthcare. If what's being provided doesn't meet that unmet need, there's the opportunity for discrimination there as well. And so those are just to get us kind of in the mindset. To get you kind of further in the mindset of digesting these survey results, I wanted to share the story and kind of go through a what if exercise with you. And again, you can use the chat to weigh in here. So this is Galena White. Galena White is a Seattle mother of two. She herself is autistic, and she signed up for early Head Start when she was pregnant with her first daughter. One of the reasons she did that was because she was worried that someone would try to take her children away, and she wanted someone to witness and support her parenting. And from the quote below, you can see how early Head Start has helped her advance and get medical treatments, also how it's helped her children advance, how she's starting a business to advance their family economically. This is a success story, but do a little bit of what if analysis in your head, right? What are some of the barriers, right, that could have presented themselves to Galena and to her family that would have prevented her from accessing early Head Start? Go ahead and put that in the chat, and let's think through some of these barriers that she might have encountered.
Yay! Who's in here? Yay! Hey. How stupid! How did I not know? I'm sorry.
Paperwork, absolutely. Kathy, staff not familiar working with adults with disabilities. Yes. Lack of understanding of the process. Understanding the process. Not having support, absolutely. So you guys are there already, right? So you're seeing how some of these barriers could have popped up to prevent Galena and her family from succeeding in early Head Start. And so thank you for getting into that mindset, doing that exercise. And let's start to dig into our agenda today while we're here today together. So first is to review the barriers. I'm going to break this agenda into 3 parts, right? First is to actually review the results of the survey and look at the top barriers to access. And you'll see that 7 barriers to access really rose to the top. But I'll share a little bit later. We didn't just rely on this national survey. This is a huge component of what we did because it was so big and specific to our field, but we did extensive other work. We're also going to look at perceptions from the field about how bias, prejudice, and discrimination have shaped and caused some of those barriers. In our second part today, we're going to look specifically at race, ethnicity, income, and other factors. We're going to look at enrollment diversity versus community as referenced in the survey. We're going to look at staff diversity versus community in the survey. We're going to look at underservice by race and ethnicity. We're also going to look at the intersection of income eligibility and diversity. And the field has a lot to say on that topic, as you can imagine. And some of it was quite surprising to me as somebody who's been in Head Start for just a few years. And so I'm excited to share some of that with you and see how you react to it too. And then finally, and this isn't the focus of today, but I do want to leave space for what's next, right? What's our collective response? And here's where I'm going to shift from focusing more on barriers and issues that the survey uncovered to thinking about the assets we already have as a community, the solutions we already know, and how we can move forward together to address these barriers. So a little bit about the survey. There were about 2,400 survey respondents from across the country. Even more important, though, I think, than the number of responses is that there were 2,500 open-ended responses and direct quotes. So there's just a ton of information. I spent a few days digesting all of this paper, and there's really 350 pages of results, right, from the survey. And this is tiny font, not big font. So a lot of information here. In terms of who responded, 56% were directors or managers, what we call leadership staff. Frontline staff, which would be teachers, family support workers, health workers, et cetera, 41%. And then parents, which were not a big target of the survey, but were captured right through our email list on occasion, just 2.3%. So we're going to focus less, of course, on the parent responses. I'm going to talk about them and mention them, but there's no scale here to really draw strong inferences. So we're really going to focus on the directors, managers, and the frontline staff with this survey. Survey respondents, just a little bit more. We did ask voluntarily if folks would identify their race, their ethnicity. So 63% of respondents identified as white, 17% Black or African American, and 17% Hispanic. In terms of geographic setting, 54% rural, 38% urban, and 27% suburban. So pretty good distribution there for our community. Again, I'm not going to go into this, but this is much more than the survey. We are layering a lit review, OHS data, child poverty data. We did a deep dive into 4 states where we held 3 focus groups per state, plus data, plus survey analysis. So I want you to know this is wrapped into a larger research package. And we can't ignore COVID and what's been happening with COVID, the impacts of COVID. The world has permanently changed, right? And we have to factor both the needs that are now have arisen, the issues that have arisen, and the policy responses that state and federal lawmakers are addressing. Okay, so let's dig right into our top barriers to access. So we really asked the question in 3 different ways about barriers to access. And again, kudos to Victoria and Amir for helping me break down a lot of this. So the first is about barriers that might be programmatic in nature or based on family status, family demographics, et cetera. So a good example of that would be hours of service, right? What hours of service does the program provide? What does a family need? A second category was administrative barriers. So think of the burden of proving eligibility, right? The paperwork issue. So that was the second category. Then the third category for us was a little bit more amorphous, but very important, which is perception. What do families think? What does the community think? What do staff think? How does perception impact eligible families finding their way and enrolling and succeeding in Head Start, early Head Start? So a good example of that would be if a parent says, hey, pre-K is better for my kid, and they don't do kind of a more serious analysis, right? Because many parents don't have that time, right? To think about what are the services Head Start's offering versus pre-K, et cetera. So if they think pre-K or have a bias or a predisposition toward that, that's a perception barrier, right? That may lead to under-enrollment. All right, so let's dig into the issues.
That's right.
I'm trying to collapse.
He's got things up, so it's fine.
And if you are not speaking, please do mute yourself. Some of the top program barriers across leadership and staff were very, very consistent. So I've actually color-coded them here so you can see how consistent they were. The top 3 answers across leadership and frontline staff were transportation and facility location, number 1, family instability, which was kind of a catch-all term, right, for some of the issues related to living in poverty. And third is the unstable housing status, which we pulled out specifically to examine the impact of that. Worth noting, I think the number 1 answer for leadership, if there'd been an option, would have been income eligibility. Now, we didn't include that because this is really focused on barriers for eligible families, but you'll see throughout this survey, income eligibility really fit into the study we were doing here. And so the field led us to that. But obviously just a lot, just complete uniformity here on program barriers. Administrative barriers, there were some that rose relatively high, but the thing I want to stress here is that administrative barriers received a lot less overall support as being significant or important than the programmatic barriers. So if you see back on programmatic barriers, our top barrier, transportation, 52%, 47%, you'll see that the top vote getter here, lack of stable communication, 38%, 29%. So a real difference there in terms of the intensity or thoughts about the intensity of that barrier. Paperwork and proving eligibility, 28% and 26% for frontline staff. You'll see the green there. And then waitlisted. So for frontline staff, that one rose to the middle of the pack there as a significant issue. And you'll see that with our parent responses as well. We did ask leadership about the perception barriers, and far and away, 2 were way more highly ranked than others. One is that parents believe pre-K in schools is better for their child. That 44% of respondents, a very strong number, indicated that is a perception issue that impacts eligible families enrolling in Head Start. A second issue that was very significant, really tied essentially for the top issue here, was the parents' lack of awareness of the program. And that was multidimensional, as you'll see later in our survey. It included just general awareness, but also what does Head Start offer? How is it different? Is it quality? So there's a lot to unpack under awareness as well from the survey, from the open-ended comments. I do want to go, as I said, I do want to go over some of the parent responses, certainly out of respect for the 55 parents who responded, also because I think their findings are very much aligned, but also there's some differences in that small sample group. One, though, I think is important to call to attention, and I imagine this will hold over a much larger sample given the difference here, is that parents really do value a diverse and a welcoming environment for their child. When we asked how important was it to you that your child's program be welcoming to their race, their ethnicity, their culture, 76% said that's extremely or very important. I have young children, I'm in this field. That intensity of that number actually surprised me, right? And I think it's a really important indicator to Head Start that your ongoing efforts on diversity, equity, inclusion, and belonging are incredibly important for your future competitiveness, right, with families and meeting families' needs. 7% said it was somewhat important, and only 14% said, not so much at all. The families really elevated being waitlisted, right, as a barrier to enrollment. You saw that show up in the frontline staff, but not in some other parts of our responses. So that was the number one issue for about a third of the family respondents, being waitlisted. The other two look a lot more familiar, right? Transportation, again, rearing its head, but also proving eligibility, 21%. We asked also, have you faced any concerns while your child has been enrolled? Yes, and teacher turnover, not surprisingly, for about a third of folks here, and transportation, again, facility location. So those were ongoing challenges that folks saw once their child was enrolled and they were in the program. Their perceptions about other families' needs and barriers were similar to staff: lack of awareness, not enough hours, the stigma of enrolling in a government program, which really leads back to the income eligibility issue. And when they were asked what can programs do to enroll more eligible families, number one was offer longer hours, and the number two was raise awareness. So a lot of similarities between some of what we've seen before, but more emphasis on their needs, not surprisingly, the hours, and helping other families even find and access the program. So this is kind of the summary slide. So I'll spend a little bit of time here. We are going to go through each of these 7 and let you see more of the direct quotes about those and some of the dimensions of those. And of course, we will share these slides with you. I'm sure that's a question that you have. So number one, geolocation, lack of transportation. This was just overwhelmingly the consensus in the survey as one of the top issues. And I should say these are ranked in relative order, but I wouldn't hold them to the exact order that they're in. The low income eligibility limits, we're going to get into that a lot more here on this webinar, but I know all of you know the need to modernize our eligibility, not just our income limits, but our categoricals as well. The lack of overall supply, right? So when a family says, hey, we've been waitlisted, hey, there's no early Head Start in our community, we don't have enough slots. That especially was an issue for early Head Start, but there's also a general lack of overall supply for early childhood services, particularly in places where there's very low supply, right? Inadequate hours of service, so the duration issue, I think we're all well aware of that longstanding issue in Head Start and the field efforts to address that. A range of workforce issues, and we're going to dig into that, the dimensions of that, but certainly our workforce is a critical part of providing access, and if they're not there or they're not qualified or they don't meet family needs, that can create a barrier too. Lack of parent awareness and the perception issues certainly make this list. And then the last one is something that we collapse into what we call kind of a mix, right, of socioeconomic issues, like housing instability, right? Like substance use, like community violence, things that are going to get in the way of a family accessing Head Start or early Head Start and succeeding in the program with their child or children. So there's just kind of a mix of those issues. And I think they're throughout the survey and very important to note here. So these are the 7 key barriers. So let's dig into each of these. So geolocation, transportation, I pulled out a few quotes that I think I'm going to focus on the right-hand side on these next 7 slides. So, because I think the quotes tell more than anything. But the first quote really keys in on something important, that demographics change, communities change, but it's hard to change facilities, right? Obviously they're brick and mortar. So this individual said, no one in our geographical area is income eligible any longer. So that creates issues, right? Obviously for access and transportation, which would need to be provided. Another person talked about the issues with public transportation. Parents that use public transportation spend on average 3 to 4 hours on the bus. So, right, when you look at the reward return, and the investment a family has to make there, you see why some of these issues are so significant. And that quote was very consistent, that type of quote. Another one is that pre-K schools often offer transportation. So families will pick, right, a program that has transportation in many cases because it meets their needs, because it solves a problem for them. And so those are three dimensions of the geolocation transportation issue I wanted to share here. On the second issue, I think you all know the dimensions of this, but just to point out a few here, the minimum wage increases, right, that are happening in localities, that are happening in states, even if they're not happening federally, are causing significant access issues. So one program in New York said we have 106 applications for next year, only 52 are income eligible. So they're looking at a huge population of folks who think they need the program, who found their way to Head Start, and they can't serve them, right? Other folks said, well, they can't afford gas, they can't afford food, clothes, utilities. How can they possibly afford daycare? They need Head Start too. So there's a strong focus in the responses around working poor families or lower middle class families who really could benefit, who really need it, but cannot access Head Start. And this was a really important one too, because it speaks to the intersection of the mission of Head Start and the rules of Head Start, which is that many families who are found eligible for early Head Start, when they're redetermined for Head Start, they're found over income. In this person's case, quote, a majority of the time. So for this individual, that's a systemic issue, right? And that's something in our system that we should be addressing. As far as the lack of overall supply, a lot of the comments, frankly, most of the comments focused on early Head Start. I think the first quote here is very representative. There need to be more early Head Start slots. If a child doesn't start as an infant, there's almost no chance they will ever get in as a toddler because the slots are full. Another person talked about the need for funding for duration. There's a whole section kind of interplay between the different funding streams in early childhood and how they do or do not support providing the hours and the supply that our families, our communities need. And the last one is really notable, and I didn't even have room on here to include all the quotes about public school issues and partnerships, some of which are positive and many of which also are negative. But some of the resistance to partnership that schools offer to Head Start was very present in the survey, and the perception that, quote, those children are not as well served in Head Start as they would be in public school. So better to bring them into the public school classrooms. So these are just a few dimensions of that lack of overall supply. But going back to that last quote, partnership is really important for meeting supply. And so that's a significant issue there. Inadequate hours of service, right? So let's go through the duration, the way folks frame that here. One person said, the only barrier I have witnessed is for the working parent, the school hours are not early enough. So in their circumstance, they're looking at families who have to start early in the day, and the Head Start program isn't meeting those needs. Second, differing hours of the program, but those hours work. Again, mismatch, misalignment, right, between what working families need and what programs can provide. And then there's kind of this competitive issue that folks raise. Well, other programs are able to do it, we're not able to do it. And so that impacts the ability for folks to have this care. And I want to say that other folks were clear, right? Hours of service duration is not just about work. It can also be about caring for a family member. It can be about caring for yourself. We don't want to reduce, I think, duration or that issue to the need to help people be more productive workers. And that's important, but there's more going on there than that. And so I do want to point that out too, that duration is about more than just helping people go to work. A range of issues with the workforce. So let's spend a little bit of time on these because it's so important and I know so critical to your program's functioning and what you all do. But certainly the wage issue was front and center. Essentially that we don't pay high enough, we don't pay competitive wages to attract a diversity of folks. And of course, we end up losing folks, right, because of that. I'm happy again at the end of this call to share good news on that front coming out of the federal government. But I think that's something that was really front and center for folks when they were thinking about this. Another person said, look, if we want to have an extended day, we need more staff, but we can't find staff. And then they talked about the impact of a recent hurricane, of COVID. All of those factors impact, of course, workforce availability. There was a really strong focus in the comments on the challenge of attracting diverse bilingual staff, language diverse staff. And so that wasn't uniform throughout the survey, but it was very much present in the survey. And the person here, the last quote here, took it a step further and said, we aren't able to pay the necessary wages to have bilingual people in management positions, so that they're not able in their community where they are to be able to attract, retain leadership who bring the diversity, linguistic diversity, other diversity they want to have in their program. The lack of awareness and perception. So I talked about this a little bit, but one of the main things that came out of the open-ended responses is that, again, folks aren't aware of necessarily the components of the program, the whole child, whole service model, what comes with that. And so it's incumbent on programs to do a good job explaining that as a differentiator and to meet family needs. Again, the competitiveness issue, right, of, hey, pre-K is perceived as better in schools. They offer transportation. So there's that perception issue, again, with other options that families have. And one person said, the perception is that Head Start is for other children who, quote, need it. So we're going to talk about stigma, bias, et cetera, more here. But certainly that stigma of this is a program that's federal. This is a program that's for the poor. This is not a program for my child. And so there's that strong perception and need to overcome that barrier to improve enrollment. And then there's this mix of the socioeconomic issues. So this is the last of our 7 issues. So I think the first quote here really captured it well. Just that availability of community resources, housing, mental health, transportation really greatly varies across the region that this person serves, right? The next quote talked about housing policies, how they segregate and isolate, how policies for bail and sentencing guidelines lock persons out of employment as well. And the last one was really notable too. I feel like the barriers are more providing resources to get parents involved in building up skills to further their success. So they really see a need here to work more with families, work more with parents, caregivers, to build up their own capacities and to strengthen them economically as well as in other ways. Okay, I know that was a lot, but I wanted to get all those barriers out for you. That was one of the reasons I know you probably joined this conversation. And again, we'll be sharing the slides. I really want to dig into some of the impacts of bias, prejudice, and discrimination. This is where we get a lot deeper into the open-ended comments and some of the dynamics and sense of dynamics around these barriers. So I think that's one of the value adds of this survey, as opposed to some things you may have seen in the past. So really notable, right, that overwhelmingly the respondents to the survey really think Head Start is well designed and well structured to address fairness and promote equity. This first quote here is very representative of the comments we saw, that they said the reputation of our program is one of acceptance of all, and families wish to enroll due to that. So really this sense that we do work to remove barriers. We are open to all eligible families. We treat everyone fairly and equally. So really strong comments, a lot of comments like that. Another person really pointed to data, and others pointed to their own data and said, no, we enroll a higher level of people of color than our demographics in our community show. So they were looking at the data and pulling that out and sharing that in their open-ended responses. So a lot of positive things, I think, here in the comments. That said, right, we all know structural racism, other issues are very much present. Classism, other issues, right, in our society. And folks brought a lot of that analysis to their open-ended comments on income and race, and also relating it to Head Start's structure and Head Start's funding. And I think that's really notable here. So one person had such a compelling quote for me, which is, we need to focus on education and supporting families. We don't need to be in the business of making families prove how poor they are, right? And so they're really taking issue, right, and capturing well the notion that we have to spend so much time making people prove that they're poor to access the program we know they need. This other one is really also about structural issue, right? We are not given the funding to pay our employees a living wage, which is a tactic to keep poor minority people poor. So really going back to the structural issues with how Head Start's funded, the lack of funding for the workforce, which we know has long historical precedents in caregiving. And so a really important comment there, which came up a lot as well. And the last one says, hey, we're federally funded, so people think we're low quality, or we're only for this certain race or this ethnicity. And so the notion that how we're funded or who we are is linked to program quality was something that came up a lot too. Going more and even deeper into this individual listed a number of requirements, right? The educational work requirement, the work hours requirement, and probably referring to childcare there, the extreme low income requirement, excludes a lot of children who may benefit from the program. So they're saying how the structure of the program is actually designed to exclude, right? Is discriminatory in its nature. This quote really struck me. I wonder if it strikes you. Say so in the chat if it does. I think the way that Head Start is regulated versus the way public schools are regulated shows institutional racism against the Head Start program. So you can take that whatever direction you want, but I think we all know what they're talking about there. A lot of rules, regulations, requirements of eligibility, et cetera, and a lack of trust that the program is accountable unless it's proved accountable. And so a really important quote I wanted to bring to your attention there too. And this last one is about the nature of our economies, right? Low wages, which leads to high rates of income eligible, but not enough funding. So again, going back to that issue of what's discriminatory, is it discriminatory, right? To set up a program that's income eligible, but not provide enough funding to fully fund it. I think you can make a good case there. And so this person is pointing that out as well, and the intersection with local economies and employment. We did a deep dive into 3 southern states, and I would say that there was a very sharp analysis of race in those states that came through the focus groups and other work here. And I'll just do a small segment of the quote here, but which I think is very representative. Head Start programs have the stigma in some ethnic communities, especially in the South, that only the poor and the Black attend there. So even if you are poor and white, you do not register or attend because Head Start is seen as the lowest of the low in the community. They go on to say there's more resources for poor Caucasians, right? And also they talk about some of the dynamics for Hispanic children and families, including, quote, fear of government reprisal. So we're talking about some very macroeconomic and also systemic racism and opinions, right, in communities that really create barriers to access, even for those who are eligible. All right, consistently referred housing discrimination. This one came up a lot. And it's come up in other work that NHSA has done too recently nationally. So this individual said, in one of our service areas, racism is apparent and historical with deep divides. The effects of redlining and housing practices are still obvious. Life expectancy is a 40-year difference from one neighborhood to the next one, just across the river. So they're taking it to specific policies, specific practices, in this case, redlining, and showing how that still impacts eligible families and communities and children today. The next person also keyed in on that, took it a little bit broader. We experienced the results of 1930s redlining still, and vulnerable communities that experience socioeconomic, institutional, health, and racial inequities, racial inequalities. So again, taking it broader and recognizing that structural racism can impact every part of a person's life, pretty much. Whew, okay, so a lot to cover there, but I wanted to give you the sense of how folks bring their analysis to those barriers, right? Because it's easy to look at a list of 7 things and go, oh, okay. But when you really dig in, when you really unpack, that's when you start to understand and you can start to get to solutions. So imagine you're interested in the next section here, right? Which is digging into some specific survey questions, especially on the lines of race and ethnicity. So we asked, does the racial and ethnic diversity of the children and families you serve reflect the racial and ethnic diversity of the eligible population in your community? And you'll see a pretty big divide here. So for leadership, they said, yeah, 63% said, yeah, entirely or mostly are the children and families we serve reflect the community that we are situated in. Frontline staff, not as much. 47%. So there's a 16-point gap there between leadership perception and frontline perception of whether the program's doing an adequate job, essentially matching racial and ethnic diversity. How about this issue? To what extent does the racial and ethnic diversity of your staff reflect the racial and ethnic diversity of the eligible populations in your community? We only ask this question of leadership because they're at that higher level, right, of managing staff and knowing more about them, and especially in large programs. And 43% said, yeah, very much or mostly, not particularly high number, somewhat 29%. But one in four said not particularly or not at all. I don't think that's acceptable to the Head Start community, right? To have a figure, about the mismatch between staff, race, and ethnicity and eligible population be that high. It's not the end all be all, right, of providing quality services. But when we did the literature review, there is very strong evidence that race matching is important for program quality. It's important for kids, families, and for program effectiveness. Again, not the be all end all, but a very important factor and something families look for as well. So we asked specifically about underserved populations, underserved demographics. Again, this is a national snapshot. Every community is going to look different. This may or may not resonate with you, but the findings were really pretty clear across the country. The number one answer was none. Most folks said, there isn't pockets of underservice where we work, where we serve. A lot of them basically spoke to the issues, frankly, of the communities they serve may be mono-ethnic or mono-race and may not be as diverse to accommodate diversity within a program. So one person said our community is 50% African-American, but our enrollment's over 75%. This reflects the socioeconomic disparities in our country. So they felt like they were doing a good job. And other folks said, well, we don't have tribal populations. We don't have X population. So the answer for them was none. Asian was the number one identified race or ethnicity, and 21% from leadership, 23% from frontline staff. So very consistent. So right, about 1 in 5 survey respondents said Asian community was underserved in their program. And this quote was pretty relevant, pretty applicable. The Asian community is growing within the area. However, there's a barrier regarding their customs and unique beliefs, which may cause low enrollment. The other two communities that were mentioned most were AIAN, again, tribal communities, and Hispanic communities, 16% and 19%. And a lot of the folks in their comments leaned into the questions of language, the questions of finding diverse and qualified staff, and that as a barrier. So let's get into the income eligibility issue, which is a hot topic for our community. This surprised me, and I wonder if it surprised you. Maybe you could use the chat, say this surprises me, or no, expected this. 69% of survey respondents said that increasing our income eligibility would yield greater diversity. That's a really large margin. That's effectively 70%, right? 7 in 10 people who said that. And we offered the open-ended response here, and folks did weigh in with some really compelling and interesting viewpoints, right? And so here are some of the ways they said that this would increase diversity. More two-earner families, more economically mobile families, more Hispanic families, more families with earners who work in factories or plants. And often they mentioned refugee families and other small business owners, children of Head Start staff. So a really strong sense that increasing our income eligibility would increase diversity. I'm seeing some not surprised at all, mostly, and some surprised. Not surprised, not surprised. Yep, diversity of thought. And that's a great way to think about it too. We'll get to that in the intangibles there in a minute. These are some of the really relevant quotes that people brought to the table. Some of our Black and brown families just missed the cutoff, right? It would allow us to serve more people, specifically the white and Asian community. Our ethnic community works at the factory. It would allow us to reach out to suburban communities where poverty exists, but may not be as extreme. Many Latinx families are above 130% of the poverty rate, as are African immigrant families. So here's where folks, right, with the quotes were really helping us understand that. And I'm thankful for that because again, this survey finding alone, well, you would need to learn more, right? What does that mean? What does that look like? Other benefits, and I saw that comment in the chat too, which I think is instructive. Higher eligibility, what else would it bring? So folks mentioned a few of the other benefits. Comprehensive services for children and working poor families who often need these supports. In fact, one of the quotes, I wasn't able to pull it out in time here, said hey, some of these families may need these services even more because their children may be kind of latchkey kids. They may be stay home with siblings while their parents work, right? So they need Head Start. They really need it. It fills in eligibility gaps that exist within CCDF and pre-K, right? There are eligibility requirements for these other programs, particularly child care subsidy. And higher income eligibility for Head Start could help to fill in some of those gaps for those populations. And this was a little bit more, higher level, but I think very important. It would be most beneficial for children from all backgrounds to learn early on how to see each other as equals. So there's a kind of child development, community development, beloved community concept of Martin Luther King that really comes through in some of the comments too, right? That bringing people together of diverse backgrounds is a win for everyone. And that's one of the passions I think folks have around higher income eligibility too. We asked about categoricals. You'll see the responses here. Folks feel like they can access and serve those communities very well. I was also surprised by how high these numbers were, but also obviously it's a good surprise, I think. So foster care, 96%, 92%, homeless, 95, 89, disability, 96, 90, right? And so really understanding that our categoricals and our disability community folks who are facing that are really, they believe, well served and well accessed by Head Start. The one caveat I provide when we dug into the open-ended comments is around the diversity of disabilities, right, and issues that we may be talking about. And so I pulled out a few representative quotes here, as usual. One is about, well, what's the seriousness, right, of that disability? Some of this, they recognize in the comments quotes that some of the serious disabilities or significant ones, we may not be equipped to handle those. And so that may be more of a challenge. Another person pointed back to the workforce. Well, our teachers, our assistants can provide the support, but there aren't enough of them to go around. We would need more staff. And so you think about classrooms that are higher staff, lower ratio, more intensive trauma care, et cetera, and recognizing that those are important to serve kids with disabilities. And then this one was unfortunate, but really quite common. Public schools will not serve kids on IEPs at Head Start. So there was a lot of issues in the community around that partnership where essentially they couldn't get these supports in the community-based setting. And it was basically forcing children with disabilities into the school setting, into special education preschool. So what's next? Here we're going to do a little pivot, right? To kind of get a little more hopeful, right? So we've heard now, obviously, about a lot of the barriers, right? But here's the positive part. And so let's go through some of the positive things here as we reflect on what we can do next as a community. We asked survey respondents, what works? What works to attract and serve diverse families? And the responses were so consistent. So I color-coded them here so you can see that too. By far, the top three answers were encouraging families to refer other families, to build authentic relationships with families, and to run a quality program. All of this is so common sense, right? But it's hard work. It is the hard work that you guys do day in, day out, week in, week out. But these were the ways, kind of the North Stars for our community. Do these things and the rest will follow. We know it's more complicated than that, but these are the things you all can control. And these are things folks lifted up. Another thing that really came through, when you think about that bucket of the socioeconomic barriers and factors that families are facing, Head Start's positioned to do more there. We know it requires funding, it requires staff, it requires that foundational work. But the risk factors that children living in deep poverty face are significant, and many of those factors fall to their parents, right? And the situation the parent may face or have. So how do we do a better job of supporting families and supporting their holistic needs and bringing that more to the forefront to reduce barriers to access? Really positive. We asked a very just open-ended couple questions about diversity, equity, inclusion, and belonging. What do you do? How do you feel about this work? Amazing responses. I wish I could share every single one with you, and maybe we'll have the opportunity to do that at some point. But here are some of the positive things people said that they do, right? One is we hire frontline staff from a variety of racial backgrounds who speak other languages. We welcome children with disabilities. We treat all families with the same respect and dignity, regardless of who they are. This was really important too, the enrollment process for SIA. A lot of folks went back to their selection criteria. This person said, our enrollment process is a blind selection process. So no one can be discriminated against and no favoritism can be given. So a lot of folks really keyed in on the structural ways that they protect against prejudice, bias, and discrimination. This person went further. They said, we allow families to self-identify race, ethnicity, and gender. That doesn't sound big, but it empowers families. And we asked them about their specific challenges and add priority points. Another person mentioned staff trainings and how they work with and hire diverse staff. Providing documents and other issue and services in home languages. And this last one is, of course, really important. MOUs, collaboration, partnerships. In this instance, with a resettlement site for refugees. We know how productive those partnerships can be to promoting diversity, equity, inclusion, and belonging. And so these are some of the things that folks lifted up. I'm on the government affairs team, so this is my slide, which is really public policy really does remain key. There's so much going on in these survey results beyond that, but public policy is important, particularly because of the funding. So when you think of the quality improvement funding that we fight for every year in Congress, NHSA is with you year in, year out, fighting for that funding. It's extremely fluid, right? It can be used for the workforce. It can be used for transportation. It can be used for other supports that families need and programs need. So QIF funding, we are looking at more of that in fiscal year 2022 in Congress, and we're going to continue to fight for quality improvement funding. More early Head Start funding. We're about to see the second biggest increase of all time in early Head Start funding. Huge, potentially $750 million in expansion funding for EHS and EHS CCP. And we know the opportunities to align with childcare systems are there too. And particularly family childcare partnerships could really support these issues and removing barriers. Required state pre-K collaboration. The Build Back Better bill is about to pass. It's really close, hopefully this week. We've got great language in there around requiring collaboration and full utilization of Head Start. It has $15 billion in workforce funding. That's $2.5 billion a year for 6 years for Head Start through the Office of Head Start, not through states. That's really going to help you start to address that compensation and wage issue and build back your staff and build back your staffing capacity. And then, of course, Head Start Act reauthorization. It's been over a decade since that reauthorization happened. It's long overdue. And we've been working with the field to modernize eligibility and to make other proposals that we think are going to make a really big difference. So again, public policy remains key here to removing barriers. So, all right, we've got about 10 minutes left, and I want to get into a little bit of discussion. I'm welcome to have folks raise their hand and offer reflections on any of these. I'd ask for support maybe from my colleagues. So to monitor that and make sure we can do that. Otherwise, let's also go ahead and use the chat. So my first question is, what's one thing you learned today that surprised you? So go ahead and raise your hand if you'd like to comment or use the chat. And we'd love to hear from you today about what surprised you. So Vanessa says, no surprises, that's good. We upped our pay to $20 an hour. It's still hard to hire. The perception around pre-K being better than Head Start. Thank you for sharing that. No real surprises. Yep, it's not really a surprise, but it's nice to know you can read it here. Build Back Better. Yep. The data across the country, excellent. Long overdue. How well the data supports the needs, good. So a lot of folks are saying, hey, these are pretty universal, which means we have a roadmap, right? We know where we want to go, even though we're locally driven, and we know that these are barriers that are very common in a lot of our communities and our funded communities. So that's helpful to know. The next question, let me go back to our sheet here. Apologies for that delay here. Is what's one thing you want to share with your peers or partners from today? What's something they weren't on the call, couldn't join? What's something to share? So go ahead and raise your hand or use the chat. The whole presentation, great, happy to share it. The diversity issue, yep. Want to share the slides on barriers. That a lot of programs are in the same boat. So this is really coming through here. You guys are really coming together around this notion that you all face a lot of common challenges. And that's partly why we do these works, right? These issues nationally is to identify those. We are all struggling. Yeah. But we also know that we have a united community, especially after hearing these comments on this call, that we know a lot of these things impact almost all of you. And we need to do more to address them. All right, so I'm gonna find, Sharon says we need to involve more Asian families. Many of this are in this together. We need strong voices. We can embrace all families. Yep. Yep, absolutely. So great comments in here. Okay, here's the part of the presentation where you get to take some action. And it's an easy action, super easy today. We're gonna have a lot more opportunities to work on policy, to work as a community, to raise our voices in a united way. But today, we've put a great post up on Facebook and on Twitter. Could we drop those links in the chat, Emily, if you'd be willing to drop those in the chat? You may have already done that. There's the tweet, and here's the Facebook post. So our post really talks about a few of the barriers we mentioned today: providing transportation, hiring diverse staff, or sorry, the solutions, providing transportation, hiring diverse staff, creating strong community partnerships, and shares our Families Unite link. And we got a great picture of a preschooler here from our archive. So I hope you'll go ahead and just take a moment to share this post, like this post, especially share it though, please, on Facebook and or on Twitter. If you're on Twitter as well, go ahead and do that. And thank you for joining today, being part of this conversation. Many of you probably responded to the survey too, so I want to thank you for your responses there. We will be sending out the slides and look for a lot more to come, right, on how we can be a united voice to address these barriers to access. So with that, I hope you have a great rest of your day and rest of your week. And thank you all for joining with NHSA today. We really appreciate it. Thank you.